Hi friends, welcome to classes by Lab Doctor. In today's class, let us discuss about this vitamin E supplements and what precautions we have to take before we take this vitamin E supplements. So you know that vitamin E जो है, it is a very important fat soluble vitamin. It will improve cell mediated immunity, it will improve your innate immunity. It is a very good potent antioxidant. It's an anti-inflammatory, anti-aging, fights against cancer cells, required for healthy skin, skeletal muscle development. So it is a very potent and effective fat soluble vitamin. But the requirement of this vitamin is around 15 milligram per day. This is the requirement for the adults for who are more than 14 years and older, okay, including pregnant women. And suppose if the woman is breastfeeding, the requirement of vitamin E would be around 19 milligram per day. Okay, so if you want to convert this into international units, like 15 milligram per day is equal to 22 international units per day, and 19 milligram per day is equal to 28 international units per day. And you can see here, this is the Evion 400 capsule, and this contains around 400 milligram. Okay, so if you are taking vitamin E supplement, then you will have to know about its adverse effects, its dosage, and what can happen if you are taking a higher than the dose required. Some people, just because they know that vitamin E has so many benefits, they keep on taking this. So vitamin E का benefit रहता है, but उसका requirement जो है, मैंने अभी बताया आपको, बहुत ही कम उसका dosage required होता है. वो fat soluble vitamin है, हमारे body में रहता है वो vitamin. तो अगर हम उसको ज़्यादा लेंगे तो there will be some side effects, like patient can have nausea, diarrhea, intestinal cramps, fatigue, weakness, headache, blurred vision, rashes, and skin reaction. Okay, so is vitamin E supplement right for you? Before you think about this, you will have to make an informed decision about vitamin E supplementation, because majority of the food will have vitamin E. It could be green leafy vegetables, it could be nuts, it could be seeds, etc. So अगर आप एक balanced diet खाते हो, if you are having a balanced diet, you will get the required amount of vitamin D in most of the diet. Okay, so when you are taking vitamin E, you have to be very careful, and you will have to take a medical consultation, especially if you are a diabetic, or if you are having a history of heart disease. Please discuss with your doctor if you are taking vitamin E, how much to take, for how long to take, etc. So patients who are diabetic, they need to be discussing with their doctor. Patients who are on warfarin, if the patient is taking warfarin, and warfarin is a blood thinner, and if the patient is also taking vitamin E supplement, there is a chances that the patient can be at an increased risk of bleeding. Okay, if a patient is having liver disease, then also there is chances that he might develop toxicity of this vitamin E. If the patient is having retinitis pigmentosa, if the patient is having vitamin K deficiency, because vitamin K and vitamin E, they act in an opposite way. Okay, so these patients have to discuss with their doctor before they take vitamin E. And pregnant women also, it is always said that, you know, in the first 8 weeks of pregnancy, it is better to avoid all such supplements. So all these have to be discussed with your doctor if you are planning, or if you are already taking vitamin E. Okay, so if you too little of vitamin K, if you are having retinitis pigmentosa, if you are having any bleeding condition, if you are a diabetic, if you have had a history of heart attack, a paralysis, a stroke, if you are having some head and neck cancer, if you are having liver disease, this can worsen the effects or increase the adverse effects of vitamin E. Okay, vitamin E may raise the risk of bleeding. So if you are having surgery, if you are planning to go undergo a surgery, you should stop taking vitamin E 2 weeks before the surgery. Also talk with your doctor if you are going to have any open surgeries or surgery for your blocked arteries, angioplasty, etc. Just tell your doctor that you are on vitamin E and they will accordingly guide you. So before taking vitamin E, you should discuss this with your doctor. And if you are already taking vitamin E and if you are undergoing a procedure like angioplasty or any operation, etc., you should inform your doctor and you should stop it beforehand. At least 2 weeks before the surgery, you should stop so that the effects of that vitamin E will wane off. Okay, vitamin E can sometime interact with certain medicines like certain antibiotics. It can affect chemotherapy medications. Sometimes it will interact with your antiplatelet medicines, certain other supplements, herbs, etc. So they might lessen your blood clotting capacity, and you might be at an increased risk of bleeding. So vitamin E can also interact with your cholesterol lowering medicines, that is your statins, and it could also interfere with the niacin. So when you are taking such medicine, it may not be completely potent if you are taking it with vitamin E. And I have already told you, vitamin E and vitamin K, they may not be a good combination because you might be at an increased risk of bleeding. So if you are taking any of these medicines, certain anti-tumor chemotherapy medicines, antiplatelet medicines, your statins, your niacin, your vitamin K, you will have to discuss with your doctor and you should get a nod from your doctor before taking your vitamin E. See, vitamin E, there is no doubt that it is a potent vitamin. It is in most of the products, and people nowadays seeing the internet, seeing the Google, they just keep using vitamin E left, right, and center. And vitamin E is present in most of the skincare products. Your supplements are available over the counter, etc. So they don't know what is the exact dose, how it will interfere, what problems it can cause if you are taking with certain other medicines. So any supplementation without the guidance of your doctor can be detrimental to your health. And vitamin E being the most potent vitamin, fat soluble vitamin, helping in your health of your skin, your muscles, your bones, your immunity, your hair, your nails, etc. This is utilized sometimes it is utilized more than it is required, because vitamin E, we get it if you are taking a balanced diet, then definitely it will have that required amount of vitamin E. What is the daily requirement of vitamin E, that we can easily meet it with a balanced diet, maybe from your vegetables, from the nuts, from the fruits, etc. We can get it from our food sources. So it is a powerful nutrient, and definitely it has too many benefits. But to protect yourself, to support your immune system, to maintain your skin health, etc., you can do this with a well balanced diet also that has sufficient quantity of vitamin E. So nuts, seeds, green leafy vegetable, they are the safest way to get adequate amount of vitamin E. This, by doing this, by including all these items in your food, by taking a balanced diet of carbohydrate, proteins, good fats, vitamins, minerals, etc., you will avoid the risk of high dose supplementation, and also there will be a adequate nutrient intake also when you are having a balanced diet. No, you can take supplements, but kindly remember that vitamin E can also cause certain side effects. It may not suit everybody. It can interact with certain drugs, and yes, certain sometimes it can cause life-threatening situations, especially when you are taking it with the warfarin, blood thinners, etc. Or if you are undergoing any kind of a surgery, open procedures, etc. That might be certain problems if you are already taking supplementation and if you have not informed your doctors. So these are few of the precautions which you have to follow before taking vitamin E. Thank you so much for watching the video. Please like, share and subscribe the channel. Thank you.